when you open the door for somebody else.
Welcome back. You know, you don't get to introduce every episode. Welcome back to the Vaccine Conversation with Melissa and Dr. Bob, who really likes to do the intro.
Yeah, you guys didn't see this, but I had the W, sound, on my lips right after she started to say it. So.
My goodness. Well, we are back with part 2 of our coronavirus summary, our COVID-19 discussion about where both Dr. Bob and I stand on this as it relates to different elements of this very complicated and complex discussion. And we just spent the last hour and 20 minutes on part 1 discussing all sorts of elements. If you haven't checked it out already, go back and check out that episode, which will be episode 98, I believe. And we are here on episode 99, almost getting to our 100th episode, which is going to be a fun little celebration for us.
Yeah.
But again, back deep into COVID-19 world, we covered on the first episode, we talked, about social distancing. We talked about the media and how things are portrayed and the division within the public. We talked about the economic downside to lockdown policy and whether or not that makes sense for long periods of time. And we covered those types of topics and different aspects of them. And today we're going to talk about a few other things as it relates to this. Of course, I feel like we could probably have 18 more episodes on this because it's just a very, very complicated data-driven discussion. And I want to start with something that we didn't get to talk about on the last one. We briefly talked about it, but let's go into it. Will there be a second wave? Do you think there's going to be a second wave? I'll let you go first on this one. Do you think there's going to be a second wave of a second surge of coronavirus cases once we open up the country?
Well, obviously there's going to be another increase. I think that's expected to happen.
Wait, so does that mean the virus doesn't go away?
I know.
Just because we're in our house, are you saying that we didn't dodge the bullet?
No, we did not dodge the bullet. We just stopped time briefly, so the bullet kind of started moving slowly towards us. No, it is gonna continue to circulate. It is gonna increase again. I would say I think that might be regional, depend on, where you live. And it'll depend if you're closer to a big city or more suburban or rural. It'll be very different in different states. And also depending maybe on their degree. I mean, if any states stay in a, total lockdown, then no, they're probably not going to have a resurgence until they eventually come out of it. And as we already said, they might be even worse off for that if that's too far in the future.
So a second wave is inevitable.
I would see, yeah, probably. I don't see why not.
I'm seeing a few articles now online that are kind of going, experts fear a second wave is going to be worse than the first.
Right.
And I feel like they're doing that right now to discourage reopening the country. And they keep referencing the 1918 Spanish flu. And what I'll say is a second wave, I agree, I think is inevitable, which means whether you lock down, don't lock down for 1 month versus 3 months, it really doesn't matter. In fact, the Spanish flu, everybody keeps quoting this saying, they celebrated the end of the quarantine in some huge, parade or something. And the next week they were hit with like the hardest thing. I honestly believe that would have happened anyway. Forget the parade, right? Just getting back amongst people again, especially the flu, which has a very short incubation period. And also is something spread amongst children that it was going to happen regardless. You cannot stay quarantined forever. It's impossible. So I truly feel like there's never going to be a point where you just miss it. It's going to come. And I think my big argument for, ending lockdown, the strict lockdown sooner is we are going to be more broken economically to have to deal with the surge that is inevitable. And like I said in our last episode, having postponed all of these other procedures in hospital settings, they're going to be made up at some point. So we're going to definitely have a surge. We're definitely going to have a broken economy, and we're definitely going to have to make up all of these procedures. To me, that is a recipe for an overburdened hospital system, literally in every hospital. It's going to be in every hospital across the country on some level. Whereas right now, the first surge never really happened anywhere else but a handful of places. So I think now the second surge is going to happen everywhere. And it's going to be because it's going to be combined with other factors now and complications because of this first lockdown.
Right.
But I think some people don't think there's going to be a second wave because if we lock down long enough, they think if we lift the lockdown, we're going to have a second wave because it was too soon. But I personally feel like it wouldn't matter when we did it. It's going to come because that's how a respiratory virus spreads. That's how a contagious virus amongst people spreads. You can't quarantine forever. People are, in some level, people are always in contact. So there's really no way to avoid it. And is there a chance that we are going to make the second wave worse now because of what happened? I think that's a possibility. And I'm afraid that they are going to say it was reopening the country too fast that caused that, which you know, their whole narrative has been very win-win for them. Because if the numbers go down, it's because of mitigation. If the numbers don't go down, it's because people weren't mitigating soon enough or enough. And there's really nobody taking responsibility for the fact that maybe this just would have happened anyway because it's a virus, or hashtag because science, right? I mean, this is just how it works.
Yeah.
You agree?
Well, yeah. I mean, something I think I talked about this on our initial Facebook introduction. We didn't really talk about this in part one of the podcast. So I wanted to kind of share, I guess, a little bit briefly of my thoughts on the initial mitigation. And like where you and I think differed was I kind of was more supportive in initial lockdown, initial, shutdown, and, whether it was 2 weeks, 3 weeks, or 4 weeks. To me, I kind of supported that because I felt like if we had not done any mitigation, I feel like we would have had a larger outbreak. I think everything would have been a lot higher. We'd have more cases, and by mitigating, I don't think we're creating fewer cases in the long run. We're just creating fewer cases in the short term. And for me, to me, the biggest advantage of that that I shared on our Facebook Live is that, to me, it's giving us time to figure out this virus and figure out how to better treat it. Because I kind of had this fear of catching it and having like a severe case and nobody knowing what to do. And, maybe I get put on a ventilator, but I wasn't supposed to, or maybe I was given a medication that doesn't really work, or there's, 6 months from now, we're going to discover a medication really helps this and we'll have much better treatments, but that wasn't available to me because I had it now. I caught the disease now. I kind of feel like by doing this initial short-term mitigation, the benefit of slowing things down will allow us to hopefully develop treatment protocols so that with the next wave, if it's worse, and then if there's a third wave, and then cases that we have, even next year, we'll be totally on top of how to treat those. So we'll have fewer deaths. We'll have fewer deaths, fewer complications, maybe figure out, fewer people have to be ventilated because we'll have better respiratory support for them initially. If there's a medication that's going to help, and people start treatment early, we'll have fewer people need to be ventilated. And so slowing things down gives us time to kind of figure that out. And to me, that seems like the biggest advantage. No, we're not lowering the total number of cases. And you're right, we might even be increasing and making the second and third wave even worse. But to me, that's kind of one benefit, and we'll see how this plays out. And I hope that people will get together and figure out what the best treatments are, because I don't know that they've done that yet. I think, people are like, yes, hydroxychloroquine, and other people are saying no, hydroxychloroquine. People are saying yes, ventilators, and people are saying no, ventilators are not a good idea. And there's got to be a way to put all our data together and put the best critical care physicians together, the best respiratory therapists together, and to figure out how to best treat this. And so by mitigating now, it kind of buys us some time for that, which to me kind of makes sense. I don't have, good data to back that up, but to me that kind of, points out one reason why this temporary slowdown might end up benefiting that part of us in the long run, even though it's going to cost us in other ways, as we've both made very clear.
Okay, well, let's talk about New York, because this gets brought up a lot. Why so many deaths in New York?
Right.
What's going on there? I'll weigh in with the two reasons I think New York is seeing more deaths than others, outside of the obvious, which is it's a city, New York City specifically, with a population of about 8.6 million people. People are basically living on top of each other, because it's just a very densely populated area that's also highly traveled, with a lot of international travel. And we know that there are about 14,000 people that were traveling between the United States and China every single day.
Wow.
And that's back in November and December. We know that was happening way before we knew about this crisis. And so, that leads you to most people to the conclusion that this virus has been here much sooner than what they're saying, which was the end of February. That has now changed to the beginning of February, because of the first California case that they're finding now is February 6th for a death, which means that probably was a exposure period around January 24th. So definitely not March, definitely not February. We know it was definitely here in January. And they're saying now that they have testing available, they'll be looking through medical records of those who have already died to see when they have proof of somebody dying that was COVID positive. So we know it probably was happening back then. So New York, very populated, lots of international travel. So that's kind of the obvious. We also know there are pollution issues there with air quality. But what else could be contributing? I mean, this was a very important thing for me to look into, because I remember thinking, after looking at data of China, South Korea, Taiwan, Singapore, early data in Europe, in Germany and other places, and then seeing what was happening in Italy, going, how come Italy is seeing this crazy, outbreak of this supposedly mild for most people, disease, virus? And I remember looking into Italy, trying to figure this out. And then all of a sudden New York happens. And everybody assumes what happens in New York is going to happen to every other city. And I can't tell you the number of people that said to me, just wait. You'll be changing your tune in a week from now. And this was, of course, several weeks ago. They assume what happened in New York, that they got it first, and this was what was going to, come out everywhere else. But it didn't. And as soon as that didn't happen, it really made me think, what's going on in New York? It's not that the virus isn't real. It's not that there aren't people dying, but why are younger people, quote, younger people dying? Granted, it's still about 4 to 5% only of all deaths are under 45 to 50 years old, even in New York. So you'll hear that story go around on social media of like, oh, my young and healthy person I know just died. And there are young and healthy people are dying everywhere. Well, the data doesn't really back that up either. I think sometimes these stories do get sensationalized. But as I looked into it, here are the two things I think might be going on that I talked about with you. I texted you about it because I said, I think vitamin D deficiency could be playing a role in some of these deaths. And I was thinking to myself, a lot of people, healthcare workers that are exposed, because this is what we were hearing, is healthcare workers were ones that were being infected and some were having complications. I was looking up studies that found 94 to 95% of nurses, 2 different studies in 2 different countries, 94 to 95% were vitamin D deficient. And then I started looking into studies about vitamin D and the connection between ICU patients and vitamin D. And the 4 main points that I came across that I thought were really interesting that really relate to COVID because of the circumstance here is that 1, patients needing more supplementary oxygen and ventilator management were those with vitamin D deficiency. Okay, that's one that absolutely totally relates to COVID because all we hear about is ventilators, and now hearing about ventilators, which we'll go into, this idea of low oxygen saturation. The second thing I came across, the risk of death was significantly higher in ICU patients with vitamin D deficiency. In fact, it was about double. So the amount of people that survived coming out of ICU compared to those who were non-survivors, as they called them, it was about a 2-to-1 ratio of not vitamin D deficient to vitamin D deficient.
Wow.
The third point was the total length of hospital stay was 4 times greater in the vitamin D deficient group. 4 times longer hospital stay, 5 times the cost for the hospital stay. And so remember, the whole purpose of lockdown was to make sure we don't overburden the hospital system. And that means the length of time that each person is taking. And so I had some nurses that were in New York say, well, people on a ventilator for the flu or pneumonia, it's usually a couple days. But with this, it's taking weeks. And this is going to lead us to our discussion on ventilators also. So the length of hospital stay in vitamin D deficient patients was 4 times higher. That's very significant. And the last thing was the total number of hospitalizations was significantly greater in vitamin D deficient groups. So we just came off of winter time. Where, the East Coast is not seeing the kind of sunshine and vitamin D levels that we're seeing here. So we're talking about not overburdening the hospital system, and we're talking about the frequency of cases and deaths somewhere. And we're looking at vitamin D data that shows us that there is an increased likelihood that somebody who is vitamin D deficient, which could be a healthcare worker, would have a poor health outcome as it relates to their ICU stay. And we know healthcare workers are working long hours, not getting a lot of sleep. They're not seeing the sun because they're inside for days, essentially days at a time. There is a risk there that those types of people would be more susceptible to complications from this, and that being maybe more specific to the area of New York. But the second, more likely and strong case I find for why New York might be really, really struggling has to do with their early ventilation protocol. And I think this is also true of Italy. So Italy had about 88% of their cases were on early ventilation. And they are showing statistically about 80% of people on ventilators die when it relates to COVID.
And
that's across the board, New York too.
Wow.
And the problem with this is people would say, oh, well, they were just already so sick that by the time they got on a ventilator, but that's actually not true because they were putting people on ventilators very early at the beginning. And with a typical respiratory distress disease, what they said is they would see 40 to 50% people die on ventilators. So this is literally double what they would typically see. And this is what caused a few doctors to come forward on social media and create these videos to discuss with other people and other doctors and medical professionals a potential change in protocol because they were seeing the difference in the thickness of the lung tissue, comparing this to, you said this is a lung disease, and that's kind of what they thought it was too, like a pneumonia-like lung disease, but that they're thinking maybe it's really not, like it affects the lungs, but it's not really a lung disease. And so by putting people on ventilators and this pressure with thinner lung tissue, it's actually causing injury to the lungs and ultimately death to the person who's been on the ventilator for the couple of weeks. And I did a post on this with lots of good details and quotes from doctors that give the very specifics to this. But in other words, the treatment could be killing the patients, not the virus. Because like we said in part 1, there's no way that you're going to see a virus that's deadly in some places and really just not deadly in others. Not when we're talking about industrialized nations and state to state. Maybe in a third world country compared to an industrialized nation. But when you're talking about an industrialized nation, there's absolutely no way one city is going to be ravished by the same virus that somebody else wasn't, just because the virus is somehow, more virulent or deadly. I don't think that that doesn't make a lot of plausible sense to me. So this idea of ventilation was really interesting once I saw some doctors coming forward. And, I've seen multiple hospital staff come forward now on this privately to me saying, I can't say this publicly, but I absolutely think this is what's going on. This is what we saw. We saw all the deaths. In fact, the numbers of deaths that you're seeing in New York right now, in my opinion, are a product of the 3 to 4 week ventilation protocol these people have been on, that they made that decision a month ago before they realized this was maybe needed to be changed. And those people have been on ventilators until they pass away. They're now passing away, but it's really as a result of extended sedation, extended time, possible cross-contamination of the ventilation tube, and all sorts of other things that can go wrong. People aren't meant to be ventilated that long, and especially not previously healthy people. And so an 80% mortality rate, obviously, for ventilation is a cause for concern. And I think that now, like, again, we saw this surge of deaths. I think it's based on what happened a month ago when they made decisions, and that they're changing the way that they are doing things. And I think other cities across the country saw that example and started to make changes to their protocols as well, which could literally save thousands of people in the end. And that's, again, a treatment issue, not so much the virus. Right. What do you think? What do you think about ventilators?
Yeah. So, I mean, like first, Washington State was hit pretty hard initially, but in a very sort of, small area. Right, it's kind of contained, so they didn't have the New York experience. Yeah, New York was like the first huge area, to get hit really hard. And you're right, they approached this with ventilators using the standard protocols because they didn't know. And I'm not sure they, people still exactly know, but just so the audience understands is when all these patients in the hospital were having very low oxygen levels in their bloodstream, but they were breathing just fine. Like, they're taking breaths, they're able to breathe in and out and move air in and out, but their bloodstream just wasn't oxygenating. The oxygen they were breathing in wasn't getting into their bloodstream. So the standard medical approach to that is to put you on a ventilator, sedate you, and let the ventilator push oxygen and push air into your lungs and try to oxygenate you that way. And what they were finding, unfortunately, is that wasn't working very well. So now you're stuck with your lungs being damaged by the very high pressure ventilator, and you're suffering complications and other infections as a result of being on the ventilator. So then a lot of people were dying because of that, because that was the standard medical protocol. So what people are thinking, and they're theorizing based on autopsies, where they're doing autopsies and looking at people's, body tissues and seeing what's happening to them, is what they're thinking is just to explain really briefly, is this virus basically attacks your red blood cells in your bloodstream and kicks the oxygen off of your red blood cells, kicks the iron off of your red blood cells. So your iron can no longer carry oxygen around in your body. So that's why you have low oxygen, because is the virus kicks the iron out of your blood cells, the iron circulating by itself and can't carry the oxygen. So that's why you have low oxygen. It's not initially so much because anything's so wrong with your lungs. It's all in your bloodstream. So then meanwhile, that iron goes to your liver and inflames your liver and gives you liver problems. And then that starts harming your body. Meanwhile, your oxygen's low, so your lungs start freaking out. The immune system in your lungs starts getting inflamed and causing actual inflammation and damage within your lungs, because now your lungs are trying to compensate, trying to figure out how to get more oxygen. So what they're figuring out is if there's a way to oxygenate your bloodstream better by filtering out, some of the bad things in your bloodstream. I'm not a critical care doctor, so I don't, have all the science at my fingertips, but filtering out things from your bloodstream that are causing all this inflammation, replenishing you with good blood cells so you can start carrying oxygen again, and then using high oxygen flow into your lungs that doesn't necessarily need a ventilator, right, so you can oxygenate through your damaged lung tissue. And without all the complications from the ventilator, they're theorizing maybe that's going to create better survival for people. And I'm not sure, I haven't seen any consensus reports yet. I haven't seen published research where everyone in New York is agreeing that, this is actually a better idea. New York critical care doctors and nurses and respiratory therapists are saying this is a problem. They're saying this is partly why things have not gone well for New York. but I haven't seen like other states say, okay, now we need to figure out how to do this better. I'm hoping people are going to get their heads together and figure out how to better treat this. But I just wanted to kind of, paint that picture for people so they could understand, why could a ventilator possibly do harm? And that's because people are thinking the COVID virus, it doesn't just infect your lungs like pneumonia does. It doesn't just infect your lungs like the flu does. It deoxygenates your bloodstream that causes this whole cascade where your lungs end up being severely inflamed and can't work. But the answers might be more about how to treat the bloodstream better and get more oxygen in. That might not include as much ventilator need as we initially thought. So that's what people are trying to figure out. And unfortunately, New York, bore the brunt of this initial phase. And so for me, again, I guess if we had not mitigated, could Los Angeles have been hit as hard as New York? Los Angeles being a metro area,
but a spread out one.
It is spread. It is way more spread out. So that
and a lot more vitamin D.
Yeah, that would have been a saving grace. You're right, more vitamin D. So yeah, we won't know. And I feel bad for New York and what they've gone through, those hospitals and the healthcare workers, and they had like 600, 700 people dying every day at their peak, or sometimes even more. In New York,
I don't know. I mean, now that they're classifying deaths that are not even related, so they're showing 2,000 died in one day, but it really was just because of change in classification. So it's hard to know, and it's hard to know how many of these things had morbidities as well, and co-infections and things. I mean, there's so much to it that I think that even using any kind of numbers doesn't really put in perspective what's accurately coming as a result of the virus.
Yeah, but I hope people are figuring out this ventilator problem, because if there's a way to treat patients that does not include ventilation, then what are we making all these extra ventilators for? President Trump exercised the War Powers, Act to make corporations start producing ventilators. What if we just need more, other types of respiratory equipment, other types of, oxygenating equipment, and, things that help, oxygenate people that actually don't include ventilation. So I hope critical care doctors are figuring this out so that we are better prepared for the next wave that not just might hit, but looks like people are guaranteeing it's going to hit.
Well, and so kind of coming off of that, let's talk a little bit about what underlying conditions place people at risk, because that's another element that I've seen show up here in why certain areas versus other areas. And one of the things that I've seen a very consistent thread here is obesity.
Oh yeah, very much so.
And so we have about 42% of our country is obese. And then we've got close to 15% that are severely obese. Okay. I mean, that's a lot. When we're talking about the millions and millions of people, guys, that's a lot. And so it's interesting because, like you said, originally people thought this virus was it was all about lungs. Right. So if you're a smoker, if you're whatever, then that's the only people. Asthma. These are the people that are going to be most at risk. It's interesting, though, because it from the data that I have come across, again, from multiple countries over many weeks now, it seems to be the people that deal with more complications are not, like lung issues are maybe fourth down the list. They're not first. And it seems to be obesity and diabetes as being the two top things. And a lot of times they're connected. But obesity, like I said, 42% of our country is obese. And so in a new CDC report, which was the most recent report that came out last week, they basically looked at New Jersey, Louisiana, and Mississippi. They said that 90% of who was hospitalized had at least one underlying condition, at least one. 48% of the hospitalized adults for COVID specifically, almost half of them were obese.
Yeah.
That's significant. Almost half of who was hospitalized were obese. And then close to 50% had high blood pressure, hypertension. So sorry, hypertension was the other second. Yes, so obesity, high blood pressure, top two. diabetes 3, lung issues 4.
Yeah.
That's been the consistent thread amongst countries too, by the way. We have to stay home. As healthy people, we're staying home, being forced to stay home, not able to work to provide for our families because we're supposed to be protecting the hospitals from being overburdened by people who, half of the cases are people that have a preventable underlying condition based on lifestyle. However, when you make policies for healthy people, quarantining healthy people for underlying groups that have risk factors that are a risk factor across the board. This is not a genetic situation. We're talking about same thing with smokers. If you smoke for 40 years, I'm sorry, but you're going to be at risk of things like pneumonia or a respiratory virus that comes out of,
Right.
You cannot expect everybody else to bear the brunt of that burden that is a choice that you've made. You can't, I totally support people in their right to make the choices that they make. However, if everybody else has to carry the load for you, I don't think that that's entirely fair.
Yeah, well, the hypertension makes sense because this is very, very much a bloodstream infection. But anything that increases inflammation in your body is going to create a huge risk for COVID-19. And we do know obesity, especially like central obesity, creates a lot of inflammation in your body. I mean, that people have known that for many years. And so if you're exposed to something like COVID, which creates this inflammatory cascade in your bloodstream that then goes to your lungs and makes your lungs seriously inflamed, again, not because the virus is in your lungs so much infecting you, but it's your own body's inflammatory response to the virus. And obesity, dramatically increases that risk. Whereas certain other health conditions might not be so much of an inflammatory situation, but obesity very much is. And I know there is some element of obesity that's genetic, that where some people, they fight this their entire lives. Like they're young children, they're overweight as young children. They never get over that body type, and they're just like, is just genetically ingrained to them. So there's going to be some people that are in that boat. So there are those situations, though. But you're right. For a lot of people, you're right. It is lifestyle choices. It is poor nutrition. Is a sedentary lifestyle.
High sugar intake.
Right.
I mean, but
we
again,
all kind of grew up that way, and then a lot of us kind of fought through it and overcame it, and we're healthier for it.
we have such a high ratio of obese and diabetic, pre-diabetic, and patient citizens with hypertension that we have such a huge portion of the population that is unhealthy, that it's going to make them more at risk. You look at Sweden, their obesity rate is about a third what ours is.
Really? Okay.
And it's going to translate into fewer deaths.
Yeah, and some of the Asian countries, I think, also have very low obesity rates, like Japan and South Korea. I wonder if that's factored into their how they've been faring with this virus.
Health is part of it. Having underlying health conditions based on lifestyle choices are, like I said, are going to make you more susceptible to everything. So that's fine when we all have our personal choice, but that's not fine when everybody else has to be a part of a universal policy in order to save, quote, this, susceptible population. Well, the susceptible population in this case is a pretty large portion of the population, which, by the way, are not getting healthier during quarantine.
Right.
This same group of people are not the people that are being told by our regulatory agencies what things that they could be doing to improve.
Yeah, you think that would be part of, in the media, the White House briefings, everything. They would say,
it should be every single day.
Obesity is... If that's, I don't know if it's the number one risk factor, but
it is from what I've seen in the United States.
If it's the number one or the number two risk factor during these months of quarantine, you have to get outside. You have to start walking every day. you have to start, you have to, buy some, fruits and vegetables and whole grains and eat healthy. You avoid sugar. You're right. I mean, we always talk about avoiding sugar just for a healthy immune system.
Yeah.
But we should be specifically targeting the high risk groups. I've heard people joking, like during the quarantine, you're either going to lose 10 pounds or gain 50 pounds, or
Right.
which one are you going to be? And I think I'm one of those lose 10 pound people so far, because Cheryl and I have been out walking almost every day. I'm also exercising in the house every day. I'm actually eating pretty healthy. And so I'm going to be one of those. It almost seems like it's politically incorrect to like address a portion of our nation who has a health problem. People are turned off by it and people are offended by it. So the government doesn't want to offend people, but
do they want to save people? I mean, every single one of these electronic signs on the freeway says, stay home, save a life. So how about they help people to be healthier to save a life? Staying home is not going to save people. It's really not. I mean, in some of these cases, we've got people who are in this category, and them staying home is actually making them more likely to lose their life when it comes to this.
Right.
So, this whole marketing campaign that they've done about staying home is going to save people. I'm staying home, I'm saving a life. It's like, well, what if you're not? What if what we should be doing to save lives is reducing sugar, change your food, get some exercise, get some vitamin D, do these things so that you can be one of the people whose lives are saved.
Yeah.
That should be what we're doing as a society, is telling everybody how to really save a life.
Right.
Staying home is not going to do it. Just in and of itself, staying home is not saving a life. They're just assuming that every single person that's not out is now one person that would have died. But of course, we know that that's not how it works.
Right.
It's not that much. It's not that airborne in that sense anyway. And everybody who catches it doesn't die. So it's not like the fact that you've removed yourself from this public area now just saved a life. It's kind of like the theory of vaccines are estimated to save 25 million lives a year, or whatever it is. They're basically estimating that if you would have gotten that disease, you would have died from it, which is silly because not everybody does.
Right.
In fact, most people don't.
Right.
Like when they talk about measles, the measles vaccine saves, millions every single year. It's like, well, you're assuming every one of those people would have died, and they won't. And the same is true for COVID. So it's been disappointing that these the leadership has not really stepped up to be solution based and to tailor the solution to who's really at risk, and to maybe help our country at this time have a discussion about health.
Yeah. And it's interesting that the stay-at-home orders are making the very risk factors that are going to make you more likely to die from COVID, is making those problems worse for people. And they should be focusing on how targeting that group of our population with information and encouragement and inspiration to help improve their risk factors.
So they're not
instead
a
of making
statistic.
it worse. Right.
To make it so they're not a statistic.
Right.
That should be the responsibility of our leadership, to reduce the statistics. And they're not actually doing that.
Yeah.
Their
Yeah, so
policies.
I never thought about this, but we always talked about other ways that the stay-at-home orders are going to create long-term problems. But it never even occurred to me that the stay-at-home orders are going to make the actual COVID risk factors worse for so many more people.
So speaking of Sweden and their low obesity rate, let's get into Sweden, because that's a hot topic right now, because they are the most widely known country right now to have gone with a different approach, and basically the black sheep of the world right now, because they've gone against everybody else and decided to not do shelter in place, official shelter in place for their country. They have done elements of voluntary social distancing. Before I have anybody who say, well, it's not like their life is normal. Yes, I know their life is not completely normal, but they do have schools open for primary school and part of secondary school. It's from 16 and older is where they made schools do remote learning. But the children are all in school, and that is because they know that children are not the ones responsible for transmission of this disease, according to their state epidemiologist. So they do not believe that children are the ones that are carrying this around society. And so they don't think that it is evidence-based to stop schools, because when you stop schools, you stop the parents from being able to work, because they have to watch the children. So it's not just about children, it's about the workforce and about the healthy adults as well. And they still have restaurants and bars open. They have, they do have nursing homes limited to no contact, just like we have here. And again, they're asking people to voluntarily social distance, but it is not a law. Nobody's citing people. There are no police out and about arresting mothers at playgrounds like just happened yesterday here. And so there's been a big discussion about Sweden, and it's funny. I'll see an article going, Sweden's coming out of this all right, and then there'll be an article going, how Sweden's getting it wrong, and it all just depends on what side of the fence that particular news organization is on, because they are trying to make it look like Sweden's going to fail at this. And they're really trying to hype up the numbers of deaths to make it look like, look at what happened. They have 30 times the number of deaths of Norway. But really, when it comes down to raw numbers, these numbers are not what the doctors today from Bakersfield said statistically significant, even in Sweden. So it's interesting. I mean, I shared some posts about their state epidemiologist, and I can give a quote, and then I want to hear your thoughts on Sweden and what you have. But he says, I want to say one thing. He said the main reason Sweden is differing from other countries is the government decided early in January that the measures they should take against the pandemic should be evidence-based. And when you start looking around for measures that are being taken by different countries, you find that a few of them have a shred of evidence. He said very few of them. Border closures, school closures, social distancing. He said there's almost no science behind most of these. And then he talks about models of infectious disease and said that these models are popular. They're good for teaching, but they seldom tell you the truth. He said they use these mathematical formulas, but he talks about the imperial model in that paper and how it was criticized. Something I did not know. He said it was never published. It's not been peer reviewed. And he said he said it's just an internal departmental report. And he's never seen any other scientific endeavor that has made such an impression on the world as this debatable paper, which has been heavily criticized.
Right, the Imperial College paper.
Right. And then he also makes something that's really interesting, a comparison to the flu. And I think that he was right on when it comes to this. He says, when the flu comes, we all say, oh, it's the flu, just like it's every winter. It's in all the papers. It usually kills, in Sweden, usually kills about 2,000 people a year, but it's normal. It's influenza. We have it every year. And the people that are going to get it, they're old and they're going to die soon anyway. So no one's very upset about it. He said, but I think if influenza came around as a new disease that you'd never had before, but suddenly it pops up called influenza, we would have exactly the same reaction as we have now. And he said, so he thinks the number of deaths from COVID will be about the same as a severe influenza winter, which is something we've heard experts say multiple times. I keep hearing that reference. But this idea that the flu was once new, right? And I've said this, and the flu was once new and it was once scary and everybody was freaking out about it. He seems to think that because influenza, even though it kills people, is not new, it's normal, that nobody freaks out about it. And all of a sudden we're shutting down the country for this. But this was the former state epidemiologist for Sweden, and he kind of giving some information on why they've done what they've done. And in his mind, it's working. They're basically plateauing at this point, and they're not going to have a second wave or much of a second wave at all because they've allowed the peak to sort of happen. There seems to be a lot of data behind their decisions, and it wasn't just random, and they've had to really commit to it and stay with it amongst all of the global criticism that they're receiving, and even criticism within their own country. So what do you think about Sweden?
Yeah, I mean, you have to realize who this epidemiologist is. And I was fascinated to find out that this, Dr. Johan Giersicki, Giesecke.
Sure, sounds good.
I don't know, but that's who we're talking about. He was the first head of the European CDC. Okay, so Europe has a CDC, just like we do in America, just like China does. he was the first chief scientist of the CDC back when it was formed. And he now is an advisor to the World Health Organization, the director of the World Health Organization. And so he's one of the world's most senior epidemiologists. So who would be smarter than someone with those kind of credentials to weigh in on something like this? I mean, like you and I will never, ever reach anywhere close to his level of expertise on these issues. And very few people in the world will. I mean, here in the U.S., we probably have some, head epidemiologists, and Asia does, and, South America and Africa. I mean, every region has these. This is the guy for Europe, all right? He no longer heads Sweden's epidemiology department, but this guy hired Sweden's current head epidemiologist, Anders Tegnell.
And he hired him back as a consultant.
Okay.
So he's still working for the Swedish government as a consultant.
Yeah, as a consultant. So this guy is hugely smart. And I think I have to, applaud his efforts. And he points out that according to the data, the correct policy is to protect the old and the frail only. Like use social distancing and lockdown measures, whatever it takes to protect the old and the frail. And he says their approach will lead to herd immunity. As a byproduct, they'll have much better herd immunity than other countries who are only having a minority of their country catch this disease. He says he agreed with the initial UK response, thought they were taking the correct response initially. And I do have to emphasize, everyone has to realize that our entire approach, our entire panic from coronavirus comes from this faulty Imperial College paper. It comes from a model paper, which I'm shocked now to find out it was never published. It was never peer reviewed. It was someone in the UK that developed this modeling paper that tried to predict how bad COVID was going to be. And that's why, President Trump did what he did. That's why everyone decided to, or most people decided to lock down, is based on a paper that was then later found to have a lot of problems with it. So people have to realize, if you're a supporter of the lockdown and you're against reopening, the whole premise of that approach was based on faulty science. And that has to be emphasized. Let's see, what else did he, he points out, I mean, when people flatten their curves, he points out that it's not just because of locking down and shutdowns. It's also because those who are going to be the most vulnerable and who are likely to die from the virus, those are going to be most likely to be harmed. They're going to be hit first in the initial outbreaks. And as they tragically pass away, there are going to be fewer vulnerable people susceptible. And that's going to naturally flatten the curve as well. So it's not just social distancing, it's not just locking down that are flattening these curves.
Yeah, he's saying there's less of a population for the virus to get to at that point as far as to create deaths. And so the deaths decline as a result of having less of the vulnerable people.
Yeah, he says, again, this is one of the smartest epidemiologists in the world with one of the best credentials. The results will eventually be similar for all countries, which is, if that ends up being true, then we can look back and say, we definitely did it wrong. That's why I love that there are countries doing it differently. And why do people hate on Sweden for this? It's almost like people are hating Sweden. They almost want Sweden to fail.
They do.
They totally want Sweden to fail.
100%.
You literally want more Swedish citizens to die because they're making a different choice than what we're making. You don't like difference. People fear things that are different, things that are unfamiliar.
They fear Sweden being right because then it would make them wrong.
Right.
Because they chose a different path. And that's more scary to them than the fact of actually searching for truth. Which one was the best path? Who cares which one you chose and somebody else chose? Which one was the best? Which made the most sense?
Right. And he predicts about 50% of their population will be shown to be immune through antibody testing because they did not do strict lockdowns. And that's going to be an advantage to them moving forward.
To protect the vulnerable.
Right.
It's actually going to protect the vulnerable, which is
Right.
the reason we're even doing this, is to protect the vulnerable. But we can't protect the vulnerable if the healthy people haven't established enough immunity to this to prevent future outbreaks. And we
Right.
obviously can't keep quarantining, every 2 months when there's another outbreak. So, I mean, there just has to be a different approach to this.
Yeah. So I would think that everyone would be pulling for Sweden. I mean, even if you support ongoing lockdowns and you're against opening, I would hope as a human being, you'd be like, you know what, they're doing it differently. I'm pulling for them also. That would be great if they succeed in their own way. So I don't know, maybe people will find their humanity. Anyway, so. Yeah, that's my thought on Sweden.
Did you have any other topics that you wanted to cover?
I wanted to chat a little bit, just, to our listeners. I mean, part of what you and I do, Melissa, is we try to, give people tools to go out and use and talk to people and help reduce hate and increase love and understanding in this whole process. And so for me, I really focus on, what do we do now? And regardless of how you feel about the shutdown over the past month, or again, that is behind us, what do we do now? And what are the best choices to get our country back on track? What's the best way to move forward? I mean, we either obviously continue really strict measures, make our economy worse while we're trying to protect more people from dying from COVID, whether or not that's true. Do we open things up gradually, which will still hurt the economy in a very big way? Or do we open up more quickly and more broadly? Let things mostly go back to normal, get on with life so we can start, supporting the economy and the recovery like we've already talked about. And then we face the next phase of the illness and some consequences of people getting sick of it again. I feel like we don't have the direct authority or power to make that choice, but we can definitely influence our government and make our voices heard. And we can influence people around us and our neighbors and our friends. So I think we need to decide how can we effectively communicate our beliefs and our understandings with people around us so that as a people, we can come together to influence the politicians on a local level, get our city politicians and our state representatives to understand, there's more than one side of this. And that's how everyone can make a difference. I mean, people are out there protesting, but you don't just protest. You have to talk to people, like having the vaccine conversation. You need to be having the COVID conversation with people. So how do you convey these messages? And I just wrote down a few, real quick tips and maybe get your take on some of this. I feel like if you don't want to just say, you don't want to just pretend that it's a totally harmless disease to everybody. I think yet you acknowledge that, the elderly are vulnerable. Those with, severe chronic medical conditions are vulnerable. It's going to be a bad disease for a lot of them. And it's going to be a bad disease for a tiny percentage of even healthy people. But the medical experts pretty much all agree it's a harmless disease for almost everybody who's a healthy person without a chronic condition who's not elderly. So it's going to be a mild disease for almost everybody. And so everyone's clear on that. So when you see bad cases, those are an anomaly. We can't let that create fear. And maybe that anomalous risk is a risk we're all going to have to face as a society. As we all go back out there and coronavirus spreads around again, we all have that tiny little risk of it being bad, but we can't let that make us just hide for the next year or the next 6 months. I feel like mitigating measures have maybe they have helped, maybe they have not helped. They've saved some lives in the short term, but you really want to talk to people about how they've hurt the economy because they can't deny that. If you're talking to people who supports this shutdown, they can't deny that it's not devastating our economy. If they are, then walk away. You're not going to ever convince them. So you have to get people to realize that this is really hurting our economy in a really bad way that's going to affect them. And you have to define economy. Again, I've said this before. You can't say that you just want to go back to getting rich for your own personal benefit. You have to focus on how our economy helps everyone's livelihood. Some people have totally lost their business and everything they've ever worked for over this. And that's a casualty that can personally affect some people. But a healthy economy helps everybody. It's how we all live and eat and stay physically and mentally healthy. It's how we support our elderly. A healthy economy is how we support people with chronic health conditions. It's how, it's how we raise our children. It's how we exercise our religious rights. It's how we have the freedom to do everything we want to do. That's a critical part of our humanity. And so we want to try to get that. To me, that's what a healthy economy is, and a healthy society. And a very, very long, severe shutdown might not even save COVID lives in the long run, even though it might save some lives in the short term, but it's going to cost us big time, and it might end up saving or harming more lives in the long run. It might even cause more deaths in the long run for all these different reasons. So if you can get people to see that, and there might be a better way to do this instead of just the strict quarantine ongoing. And so I guess develop your own ideas. Like, what do we do now? Yeah, we can argue whether or not we did the right thing in the past, but what do we do now, and how do we go forward? And if you can get people to support reopening in the proper way, then we can start influencing our leaders and our governments to listen to us. Because if we all band together on this, then I think they will have to listen to. This isn't a vaccine situation. This isn't a vaccine topic. This is a topic, that I think our whole society can hopefully get behind. Well, so that's kind of my little spiel on maybe what people can start thinking, what they can actively do as they keep themselves healthy and positive. And
can I call that a rant?
You can call that a rant.
Yes. I'm not the only one. So I would just say, like you're saying about getting involved, I think kind of the local level and state level representatives need to be accountable also. The way that we've been trying to keep them accountable for laws, like we forget, just because we're not making a law doesn't mean they don't work for us. Right, and at this point right now, if you're a business owner and if you are, you have data you want to show your local representative, then you need to come together with other citizens and constituents and talk about the struggles you're facing with the policies that they're enacting. Because essentially these are like makeshift laws, right? They're not laws in the books that anybody voted on, but they sort of just enacted them all. Right. So I think that's an element we haven't done yet, which is to get everybody calling and visiting and showing up to their representatives, because there are still people in the offices and they are still accountable for, and again, even on a local level, like even your local mayors and their office, and saying, hey, we have this number of cases, like Orange County, for example, 3.1 million people. When you have 30 deaths in a population that is not that far off from LA, which is 4 million, but they have a lot more than that for obvious reasons. Deaths or something, so when you look at those numbers and you say, hey, we need to fight as a county to be able to open up our businesses so that we can resume some normalcy here. Businesses are about to go bankrupt. People are going into poverty. They're going to be homeless. They're not able to pay their bills, and they have children to feed. We need to look at this in a more tailored approach. And here's the data that shows this. Like, we need to start doing that, I think. And that's something I have not seen yet. Yeah. And in California. It could start with going to your local, Sunday rallies with people. And, it could, but the thing, but then you're right, reaching your local legislators. The rally is what you do for media and for other public to see what's going on. You're right. But, to play by the rules, so to speak, you also want to air your grievances, and your grievances as a citizen, they go to your political representatives. Yeah. And this might not be so much about sharing data. This doesn't necessarily have to be data heavy, because not data heavy, but you can. So much data. Right. But some look at your, there are some data, but it might even be something simple about, the freedoms, the importance of the economy. Again, not your own personal wealth, but
what you think, our city should be doing to help start recovery, and the importance of that to the economy, and how that helps everyone's health. And you would want your representative to consider that in the equation as they're, weighing whether or not to support the governor's lockdown versus the push to reopen things. They're going to be talking to the governor. The governor's having conversations with mayors and local representatives,
Well, right. And councilmen and councilwomen
So it
and
all
things like that.
matters.
These are business people. So they're going to understand, if you're a business owner, they're going to understand what you're saying as it relates to, these are the projected numbers of unemployment we are going to see. Here are the projected, so sometimes that data is good. I think that, I think it should be a combination of sharing your story, like we always say, because if you are a small business owner and you are going bankrupt because of what's going on, you have a right to go to your local city leadership and state leadership and be able to say to them, look at what's happening to my business that I've spent 30 years building in this city.
Yeah.
And the small business money that came from the federal stimulus package is gone. It's already used up, and many people didn't get anything. And so it's not like everybody's getting bailed out. Not everybody is. And those kind of stories, I think what happens is a lot of people just like with the vaccine issue, they just kind of assume, who am I? Why do I matter?
Yeah.
And they don't realize that sometimes this can influence policy, because I have seen some local mayors, not in our state, unfortunately, but local mayors going against the governor's order and requesting to have their own individual policies. And so it's possible.
Yeah.
It's possible, but it requires people getting involved.
Yeah, our Dana Point City Council was having their council meeting yesterday, and a friend of mine texted me and said, "Hey, you can email the council," and so I just sent them a quick email saying, "Yeah, I've been a Dana Point resident for the last 30 years, something like that," and I support keeping our beaches open because, it's important for us to stay healthy. And that's all I did. I just sent that email because they were talking about that. And,
Right.
We're like the only area in all of, Southern California that has open beaches, because people see how important that is for health. Mm-hmm. And that's going to help in the long run.
And for mental health too,
right,
physical and
right.
mental health.
Right. So it's a simple email, and they actually read all the emails at the council meeting and my name. They read the person's name and what they emailed. And I was like, oh, cool. My name, and the fact that I emailed them is on the record at that, just a little city council meeting. You guys can make a little difference like that.
I'm even guilty of having not gotten involved that way yet. And I think that's what's coming next. Maybe a directive for people to be calling their local city and state employees, representatives, and taking it to another level as a citizen, because the protesting I support as well, of course, because that's somebody's individual right to peacefully express themselves and their struggles and ask for change, which is what they're doing.
Yeah, and a lot of representatives are having virtual town halls, and our Orange County and North San Diego County federal representative has a town hall every week, and he asked for emails. I emailed him. How are you balancing the needs, for our economy to reopen with the needs, to protect the vulnerable, because, we do need a healthy economy in order to, help protect the vulnerable. And I even, you can email these ideas and these questions and these concepts, because we always say emailing doesn't matter, showing up in person is the only thing, but they're asking for emails to give input because you can't go in person. Yeah, but they're asking, and that means they're reading and they're looking for questions to answer in their town halls, and I think they're looking for that input virtually.
Yeah, well, they're not getting very much interaction, I think, right now during this time.
Right.
So they're probably looking for engagement because they're used to doing all these socials and these little towns. They're used to being involved in the communities. They're not able to do that now. So they're probably really looking for that type of engagement.
Yeah, and the more people they hear that you don't support a long-term strict lockdown, the more people the more they
Right,
hear
that's what
from,
I'm
that's
saying.
going to influence their
And if everybody stays quiet and just kind of goes, well, this is how I feel, but I'm not going to say anything, then we're going to be in that same boat where they're going to be making policies for us that we're just going to be huffing and puffing about, but we never made our, intentions clear on that. And I think that is important. And of course, as you guys can tell, there's still so many aspects we haven't really gone into because we've talked about them before at different times, or just because we didn't really have time this time. But if there's something specific you want to hear as it relates to this, go to my Facebook Live that we just did a quick Q&A on, and it'll be a couple days old at this time. It'll be April 22nd. And go look in that and type some things in. And if we need to readdress, we can come back and kind of go through a few things. But obviously this was extensive as it was, and I'm getting tired.
Yeah, I
and
know.
need
It
to
is
go.
really late.
I need to go home and go to sleep.
An hour past my bedtime.
So thank you guys again for tuning in. I'll let you sign off this time
All
since I
right.
signed off last time.
Yeah, well, thanks for joining us on the vaccine conversation. And we will see you next time for episode 100, which will be a fun little treat for you guys. We're looking forward to it.
We're gonna be the peace we wanna see in the world. Yeah, be the peace we wanna see in the world. Be the love we wanna see in the world. Be the joy we wanna see in the world. Be the change we wanna see in the world.
The information in this podcast is for entertainment purposes only. It is not intended as medical advice. Always consult your healthcare professional for information on vaccines and infectious diseases.